first speaker of the night, Dr. Cindy Duke, is a Johns Hopkins and Yale trained physician, scientist, and entrepreneur who is board certified in gynecology and obstetrics, as well as fellowship trained in reproductive, endocrinology, and infertility. Dr. Duke is the physician founder, medical director, and lab director of the Nevada Fertility Institute in sunny Las Vegas, Nevada. In addition to her medical expertise, Dr. Duke is a Ph.D. trained, award-winning virologist whose research interests centered on the interplay of viruses with the human immune system. She's actively creating and curating information about the coronavirus for the general public. Dr. Duke is also a clinical assistant professor at the University of Nevada, Las Vegas School of Medicine, where she plays a role in resident and medical student education. Outside of working in the office, Dr. Duke enjoys gardening, photography, baking, and writing poetry. Her extracurricular work includes outreach to women and girls to encourage and foster their continued interest in the careers in science, technology, engineering, and math. Dr. Duke is also a producer of a number of informative online programs aimed at debunking myths surrounding fertility, infertility amongst men, women in the diaspora, and those within the LGBT community. Dr. Duke understands the value of giving back to her community, which she views as the global village. And we are delighted to welcome her to our village and hear from her tonight. Without further ado, Dr. Cindy Duke.
Hello, everyone. Good night. And oh my goodness, thank you for that warm welcome. It is indeed my honor to join you here tonight on such a momentous event. Given everything that we're facing this year, I was really happy to learn that you were still able to host this gala. One of the things that really moved me was watching that introductory slide where you noted all of your accomplishments over the past 12 months. And boy, you guys have been so busy. You know, I think everything that you're doing is so needed and is perfectly timed for the situation that we're facing and what I'm going to talk about tonight, which is recurrent pregnancy loss. I know Vanetta asked me to emphasize things about how we can remain healthy for moms who are trying to conceive, currently pregnant, and post-pregnancy, or God forbid, pregnancy loss. And so I wanted to start this talk tonight by actually sharing a story of hope. And I'm going to tell you about my patient, Elle. Elle is a 34-year-old woman. When she first came to see me, she was 32 years old. And she had, at that point, already had 13 miscarriages in her reproductive lifetime. By the time that she'd seen me, she had gone to a few other specialists, not just a fertility specialist like I am, but she had seen a hematologist, which is a doctor to investigate blood clotting disorders, etc. She had seen a number of surgeons. She had gone to a number of complementary alternative medicine therapists, as well as a few other fertility specialists before seeing me. When she came in to see me, as we went through her story, every question I asked her, she said, they already checked for that. They already checked for that. They already checked for that. And I said, I understand. And I could see she was getting frustrated. So was her partner as well. And so I paused and I said, you know, forgive me if it seems like I'm asking you things you've answered before. But it's really important to me to make sure that we truly have left no stone unturned. And that's the key to talking about pregnancy loss when someone has experienced such tremendous grief and has felt like there are no answers. And as we talked, I told her everything that I wanted to look into. We went over the things that she said had been looked at before. I asked, well, would you at least allow me to get all those records? And I did. I got all the records. And in looking through everything, I realized one key test hadn't been done in terms of what I would do for a patient who presented with her story. And so after going through all the records, we sat back down for a follow-up visit. I told Elle my thought, and she said, well, I know you're saying that, but it can't be that. And so after that, I didn't see her for a year. And a year later, she showed up and she said, you know, I've had more miscarriages. I even went and I did IVF at a certain clinic and I still miscarried. I said, wow, well, I'd still like to do that one test that we talked about. And so we went ahead and we did that test. It proved that we needed to do surgery. We did her surgical procedure, and I'm happy to report that they're now proud parents of a son who was conceived without any other intervention from me other than that surgical procedure. Now, that's one example of this story about recurrent miscarriage, but it's a story I wanted to share because despite having more than 10 miscarriages, she still went on to have her baby. And that's really the whole point of this conversation tonight, is to let everyone know that there is hope. No matter how dark it feels right now, no matter how painful it has been, there's hope. And the question for the answer when it comes to hope is, how do we approach? It's important to know that each patient is different. It's important to know that while we're all talking about an umbrella topic here tonight, which is recurrent pregnancy loss, we have to remember that the cause for miscarriage for each person may be different. The timing of loss may be different. You know, so Elle kept losing pregnancies in the first trimester. For some patients, their losses happen in the second trimester. And for some, their most unfortunate loss happened at the time when you'd expect the birth of a viable infant. And so it's important to know that if you're at home grieving, if you're at home, maybe you're not the one who's carrying the pregnancy, but you're the caregiver or the partner or the confidant of the person who's had losses, is to let them know that 95% of women will go on to have a successful pregnancy despite pregnancy loss. And a loss is a loss, whether you have a loss at just a couple weeks into pregnancy, whether it's at the end of a pregnancy when you're expecting your take-home baby, it is a loss. If you're someone who's undergoing fertility treatment, you know, I like to talk about this particular timing, which is what we call the period where you have ovulated or you've had your embryo transfer and you're awaiting the result of the pregnancy test. And we fondly call it on social media PUPO, or pregnant until proven otherwise. And I like to talk about that period because for every person who's been trying to conceive, those 2 weeks, they're full of hope. Your body is feeling like, yeah, this is probably happening. You're hoping, you're dreaming, you're wishing, and then you might have that unfortunate negative test, which can really rip at your heartstrings. Yet people who you tell that to would say, so you weren't even pregnant? What are you talking about? And that can be so hard to explain when people respond to you in that way. And so I want to say to every single person who's listening, whether you're the person who's actively trying, the one who's had the multiple losses, the one who's maybe had 2 losses, not in 10, the one who has had over 10 and thinks, well, there's no hope for me. I want to say hope isn't lost and there's a lot you can do. Now, to address specifically what Vanetta asked me to cover tonight, which is how can we focus on a fertility diet. I wanted to talk about diet in part because it's one of the tangible things that we can change and impact in our bodies when it comes to our biochemistry or hormones, as we're more fondly aware. And it's important to know that our diet can and does impact our nutrition, which impacts our fertility and even our pregnancy outcomes. And so when we're talking about pregnancy loss, in so much as it's a big umbrella topic, and in so much as we know that 1 in 4 women in her lifetime will, reproductive lifetime that is, will experience at least 1 pregnancy loss, it's also important to know that there are some things we can try to change to reduce loss when it comes to certain types of diseases. So, you know, when we look at the community of women of color around the world, we do know that we see higher rates of diabetes, we see higher rates of hypertension or high blood pressure, we see higher rates of high blood pressure related diseases known as preeclampsia, or as we now call it, hypertension in pregnancy. And it's important to know that some of these do have direct correlations to what we eat, whether we exercise or not, and how much we eat. And so while it's important to do your prenatal checkups, take your prenatal vitamins, I also want you looking at what you're eating, having a nice balanced diet, meaning you should have a healthy amount of carbohydrates. Working on how much water is in your diet is super important. It's important to watch your salt intake. When it comes to salt, salt is hidden in a lot of foods. So while we need salt to flavor our foods, because I'm the first one to get upset if somebody isn't seasoning food, it's important to know that salt content plays a really big role in terms of overall total daily sodium intake. And so I wanted to touch on that as well. When it comes to exercise, I like to tell patients the goal here isn't so that you end up with a supermodel figure. If you do, that's great. But honestly, when I talk to my patients about healthy exercise, it's not because I'm trying to body shame anyone, nor is it because I'm trying to get everyone to look one certain way. Everyone has their own unique body type. But what I want is for you to use your muscles. That's really why I want you exercising. I happen to know that when we exercise and use our muscles, then our body, in order to recover, needs to recruit a lot of hormones, which are healthy hormones like insulin, etc., to help it recover from exercise. In so doing, your brain gets new and important signaling that actually works really great also for your ovaries and your fertility. And so I like to encourage my patients, especially if you have an underlying history of polycystic ovary syndrome or PCOS, if you're someone who has endometriosis or chronic pain syndrome, if you're someone with underlying autoimmune disease, all of these are improved with some regular exercise. And so I encourage my patients to do somewhere between 3 to 5 days of 30 minutes just walking. If you can achieve 10,000 steps per week, you're halfway there. But the other half is doing what I call resistance training, meaning really working those muscles, using them. And so I like to encourage people to do 2 to 3 days, non-consecutive days, so like every other day in any week, to do just 30 minutes of resistance bands. If you have access to dumbbells, a couple rounds and reps, not really a couple, it's like 10 reps with your dumbbell. But honestly, if you also don't have access to those things, it's just doing your stretches, doing something like yoga, really moving the body, working the muscles. If you're going to the supermarket, packing and unpacking your groceries, that helps. If you're cleaning the house, really healthy, in a healthy way, cleaning the house, participating in that, all those things help to use those muscles and work them. And that in turn helps your body's messaging system, which is your hormones, work together. Because even if we're trying to talk about fertility or pregnancy, it's important to know that your brain is this really amazing headquarters, which it's always checking not just the system you want to work right now. It's looking at things like your thyroid, how is that working? It's looking at things like your pancreas, which is making insulin and a few other hormones. It's looking at your liver. It's looking at all these other glands and organs that make important messengers to see if it's healthy enough as a body to carry a baby. And if any of those things are off, those things can negatively impact ability to get pregnant and then ability to stay pregnant. And so that's what I wanted to highlight in particular, but I know also there were questions, so I didn't want to keep it without going over the questions as well.
I just want to say that was amazing. That was my first time really hearing about the muscle working part of it in the journey. I always hear about exercising. My doctor tells me to walk 30 minutes a day. I always hear about the nutrition, but I never heard about the working the muscles and stretching. So I think that's a very important piece that I've missed. So if I've missed it, I know a lot of people have missed it. And then I also wanted to touch on when you said hope at the beginning. that just resonated really well with me. I just turned 42, and I was talking to another lady in this journey, and she just turned 41, and we say sometimes you'll go to the doctors and they'll tell you 41, 42, that's it. Just, it gets harder, it's tough. And I remember like getting ready to turn 42 for like 2 weeks leading up to my birthday. I was anxious, and I don't really get anxious, but I had heard the 42 term so much that it just, it made me, I don't know, it just made me like, oh gosh, I'm gonna be 42, that's gonna be it. But I'm still trusting and I'm still believing, so, and still having hope is what I'm saying. It's not, listening to definitely listening to science, but not thinking, okay, I'm 42, that's it. So you touched on 2 key points that really has helped me out tonight. So I hope it helps anybody else that's watching. And I think tomorrow I'm going to start using my muscles, because I hadn't been. So I'm just looking forward to doing that.
Indeed. And, I think for a lot of people also, if we think of the old school advice, even with pregnancy, a lot of people were told you shouldn't do any type of exercise in pregnancy, which of course isn't true. Now, you have to be safe with how you exercise, and you should definitely talk to your healthcare provider, your doctor, your midwife, your team before you embark on any exercise activities. But we no longer advocate for people not working out or exercising in pregnancy. In fact, we know that women who maintain a regular exercise routine have better and more improved pregnancy outcomes than those who do not. We happen to know that exercising, particularly those pelvic muscles, are really important for also healthy pregnancy and carrying a pregnancy safely. We know if someone is diabetic, hypertensive, if they actually exercise in a safe way, meaning with some supervision during pregnancy, they also have better outcomes in terms of the birth weight of their baby, in terms of how they perform in labor and delivery. And so there's so many ways that exercise can benefit you before getting pregnant, but also once you're pregnant. When we exercise, we can also burn some body fat. And so we know that women, for example, with PCOS, your brain is really fine-tuned to monitoring your body fat percentage. And so if your body fat goes over a certain number, there's this switch in your brain that turns off, meaning it doesn't allow you to ovulate, to release an egg. And so it's not uncommon to hear women with PCOS describe that once they started exercising, their periods came back or became regular. And that's because that switch turns on or off based on your body fat percentage. And so, the flip side of that is those women who they gain just a few pounds, and they're like, I gained some pounds and my periods were out of whack. And as the fertility specialist, hormone specialist, I will ask them, if they didn't share that they had gained weight, I'll say, has anything changed in your weight in the last year? And it might be as few as 5 to 10 pounds, but it's enough if it was already near that threshold for the switch, for your brain to switch over. And so it's really, really important working those muscles, because the muscle working is what's gonna dictate how fat is either stored or burned in your body. It's not just cardio. And so like I tell my, PCOS patients, diabetic patients, I want you to work out. I love if you're doing aerobic exercises, going to cardio classes, but that's not my focus. My focus for you, because cardio is literally that, it's working the cardiac system, it's working the heart, which is good, but I want you working all the other muscles of your body.
Nice. I'm not sure if we have questions. I can't see, so I don't want to ask all the questions, but I do have one more thing, and if you can touch on really quick for us, is stress. I know with so much going on right now, with the COVID and everything that's happening, how does stress affect fertility and hormones, and any recommendations you have for that?
Yes. Well, you know, in so much as we tell people stress does not directly cause infertility, stress does not directly lead to miscarriage, we know stress can cause changes in your body that can then lead to those very things. So when people are under stress, and you know what's interesting about the word stress is what might be stressful for me may not be as stressful for you, and vice versa. So also when I talk about stress, I really like to encourage people and families not to diminish and dismiss someone saying, I feel stressed. Because stress is a biological, psychological response. It's a response that leads to hormonal changes in the entire body, starting with the brain. So we know that when people feel extremely stressed, one of the hormones that goes up is cortisol. And cortisol, what we call the stress hormone, actually then has feedback on all of your organ systems, including other key hormonal systems like your thyroid. It plays a role with your pancreas and how your body recognizes sugar and the need to take up sugar. And so we happen to know that, and it also impacts your immune system and your nervous system in terms of what we call your catecholamines, you know, your flight or fright hormones. And altogether, those can have negative impacts. We know that during this pandemic, anxiety levels have risen, just baseline anxiety. And certainly across the board, healthcare providers are reporting that they have had more requests for anti-anxiety, depression, or stress medications and therapies. So yes, this pandemic is taking a toll on everyone. And it's not just being at home. You know, people are concerned about different things, including, am I going to get sick? Or is my family member who is high risk, is this potentially devastating for our family? And so stress can and does have an impact on those other hormonal systems, which do have direct impact on our fertility. You know, let's just talk about the thyroid gland, right? We happen to know that women who have either florid hypothyroidism, meaning underactive thyroid, let's say your thyroid was removed, thyroidectomy, and you've never been put on the adequate dose of thyroid hormone to replace that, or if your thyroid as a result of Hashimoto's or other thyroid disease isn't functioning optimally, we happen to know that that can change how your ovary is responding to the stimulation it gets to release an egg. But more importantly, once you get pregnant, it has a direct impact on your ability to stay pregnant and to grow a healthy baby. And so these are things that need to be addressed, things that must be addressed if someone has had a miscarriage before. You know, talking to a specialist, a lot of people are probably wondering, why is an infertility specialist talking about pregnancy loss? And the truth is, pregnancy loss falls under the purview of the infertility specialist because it's a special type of infertility, especially if you're someone having recurrent pregnancy loss, to be specific. And, you know, I can't tell you how many people I've met who have recurrent pregnancy loss and have seen lots of different people, but have never walked into a fertility clinic because they presumed I can get pregnant. So that's not my problem. I don't have a fertility issue. But the truth is, if you've had 2 or more losses in your lifetime, we define that as recurrent miscarriage, whether they're back to back or not. And so if that's happened to you and you are now trying, you should talk to someone about it.
Wow, thank you so much, Dr. Cindy. Like, that was, you gave us a lot of information and shared a lot of your wisdom with us, and we definitely appreciate you joining us tonight. You know, you had a busy day, so for you to come on and give us that, I know I took some information away from it, and I hope that the other ladies or everyone that's watching definitely took some information away from it too as well. So thank you so much. We can't thank you enough. I know we were also just honored to have you.
Thank you for having me. It's been my honor.